So we're gonna have our fellow acupuncturist, Mary, come over. And so Carrie's just gonna walk us through a little demonstration of how acupuncture works. And obviously the needles are very small, so you might have a little difficulty seeing them on the webcam, but hopefully you'll see a little bit of where she's putting them.
Before I begin my demonstration, I wanted to give you all a little more information in case you're interested a little more about how acupuncture works. So what we talked about today is really just the tip of the iceberg, just one little piece of the puzzle in how acupuncture works. It has a myriad of effects in the body. And in fact, in the past 10 years, there has been a phenomenal amount of research from a Western medical perspective of how acupuncture works. So a website I'd like to recommend is Chris Kresser's website. He is a licensed acupuncturist, and it's CHRISKRESSER.com. I liberally borrowed from his beautiful information in discussing this today. So he has amazing information written for the layperson. You don't have to have a Chinese medicine or a Western medicine background in order to read it, along with tons of links for further information, books, publications, in case you're interested in all of this wonderful research into how acupuncture affects the body. So like we said in the poll, we only use single-use, sterile, disposable needles. It is our clean needle technique class that teaches us exactly how to make sure we're inserting needles safely and properly. In the past, many years ago, acupuncturists did sometimes use reusable needles, but the problem with reusable needles is they get dull. So acupuncture needles are actually sharpened by eye under a microscope, and it's impossible without using a microscope to look at a needle and see if it's dull or not. After we insert a needle the first time, it immediately becomes dull, and the more we insert it, the more it becomes dull. So in between uses, after the needle has been sterilized, it's getting more and more dull, and you can't tell. So most acupuncturists, even though they're required to use disposable needles, would still not choose to use reusable needles, because not just because of the sterilization issues, but because the needles are dull and it's just not comfortable for the patient. So the needles are, we say painless, although sometimes people will feel a little bit of a pinch akin to a bug bite when they're inserted, but they are so tiny. And if, for example, your muscle is a little tight and the needle doesn't feel good, or you move and the needle gets uncomfortable, your acupuncturist can simply adjust the needle or take it out. So it's not that you're stuck with needles in you. The needles feel great. So I'm demonstrating on Mary Cole. She's one of our amazing acupuncturists here at Many Rivers. She has lots of community acupuncture training, and we are really lucky to have her, as well as our other staff member, Heather Finn. We make a nice team, and we're happy to have her here. So I'm inserting a few needles that we do very often for low back pain, although some of these can also be used for an ankle sprain. So if, in my example of falling on the ice, you injured the outside of your ankle, this point here is good for the outside of the ankle. There are other points we could use to target the inside of the ankle or the back of the ankle. But in the balance method acupuncture that we use, we never put needles directly into the site of pain. We certainly don't want to needle into swelling or anything that's uncomfortable, but we can needle far away from the pain and actually on the opposite side of the pain. So these needles here would be if Mary injured her right ankle, or some of these would also be if she had right low back pain. So we let the needles rest for 45 minutes to an hour. After that, we remove them. But the beauty of acupuncture is even after the needles are removed, they are still making physiological changes in the body for the next 24 to 48 hours. So not only does acupuncture have a cumulative effect from treatment to treatment, there is a long window of active physiological changes that are going on.
I have a question. So because the web camera, it's not the highest quality, and normally you would never get up from your chair during acupuncture. But Mary, I'm wondering if you could kind of show your hand to the camera a little bit.
This way, right?
Yeah, just so people can kind of see. Yeah, you can see like super small, hopefully no one's squeamish. They're very little light needles. They're just super tiny. So I just wanted to make sure people could actually see those. So thank you.
So acupuncture activates the parasympathetic nervous system. And if you haven't had acupuncture before, you might be surprised that most people end up falling asleep during their treatment and wake up forgetting that they have needles in at all. For those that don't end up falling asleep, they go to a place that we call AcuLand. It is a very relaxed state where you might be drifting in and out of consciousness, or just feeling happy and warm and cozy. And again, even after we remove the needles, you stay in that parasympathetic state even after the needles are removed. So acupuncture is a great stress reliever in addition to being a pain reliever.
Cool. Okay, so with that, I guess you can take the needles out, and then I'm going to come on screen and we will answer some questions.
Great.
And so now you can see how the needles come out as well.
So I am going to just grab the sharps container.
Okay. Safety is of utmost importance.
So all of our needles go into a sharps container, and then they actually are incinerated, just to make sure no one wants to use them again.
And we have some good questions coming in. So while she's taking out those needles, guys, if you have a question, just write it into the control panel on the right, and then we will get some of those answered. Hi, everybody. I'm the voice you always hear on webinars. So let's see. We have a question from someone who's asking, is there progress on getting acupuncture covered by health insurance?
So that depends on the state. California is one of the best in terms of insurance coverage for acupuncture. Connecticut, where we are, is, I wouldn't say one of the worst, but it certainly isn't the best. The good news is just this week, Medicare announced that it will start covering acupuncture for chronic low back pain. Now, unfortunately, the only cases that it will cover are if people are involved in a long-term study about back pain, but at least it's a start, especially because of the opioid epidemic and all of us looking for better ways to manage pain. This is a really great first step, so we're really happy that that happened.
Yeah, and we will actually be talking about that a little more during the staff updates. We're going to be running an action campaign, so you can help write in, because there's actually a comment period associated with that. So if you're interested in helping out on that, tune in for a little bit longer. So let's see what other questions do we have here. One was, if it isn't covered by insurance, like what would you recommend for maybe trying to get it covered by insurance? Have you ever seen anyone have success with that?
I haven't seen people have success with getting it tried to be covered, but it is covered with HSA and FSA benefits because it is a licensed healthcare provider, I guess. So if you do happen to have an HSA or FSA, it is covered. And again, for those of you without acupuncture insurance coverage, like myself, the community acupuncture clinics are a great way. Like I said, there's over 150 across the country. There's more growing. We do have our own community acupuncture school called Pocatech that is significantly more affordable than the other acupuncture schools in the country, and train people to become community acupuncturists. And in order to go to that school, you must either open your own community acupuncture clinic or work in another community acupuncture clinic for 2 years after graduation. So we're hoping there's going to be a lot more community acupuncture clinics across the country because of this need, because there's such a disparity between, one, people with health insurance and those without, and even those with health insurance, depending on what state you live in, whether it's going to be covered or not.
Great. We have a lot of good questions coming in, so we'll do our best to get through a few more. One question is from someone who's asking, are there any conditions that acupuncture is not recommended? And just to note for you, we do have a lot of people in our community who have complex regional pain syndrome. So I think she's maybe wondering about something like that, and if that's
Oh, sure. Okay. We've definitely treated patients with complex regional pain syndrome here in our clinic. The only contraindications for acupuncture are if you have lymphedema. We won't needle into that limb. So, for example, a lot of women have lymphedema in their arm, or the risk of lymphedema in their arm after breast cancer because of lymph node removal. So we will just skip that limb. The beauty about acupuncture is there are hundreds of points, and even if we can't do one limb or two limbs, or even if we can only do your head, because we've had patients that we could literally only needle their head, and we still can get great results. And of course, acupuncture can't treat cancer, so we can certainly treat the side effects of cancer and the side effects of the medications or the treatments, but acupuncture won't work for cancer. But besides that, those are the only limitations. You can take blood thinners, you could be a diabetic, you can have a host of medical issues, and believe me, most of the patients who come in here, they see our paperwork and they ask if they can write on the other side, because no one comes in here with just one thing. We all have multiple issues that we're working on, and that's fine. We can just start at the beginning and work through what you have.
Cool. That sort of speaks to my experience with acupuncture, because I have spine pain and very sensitive neck. So this type of acupuncture is great because we're never actually going into that area. It's all in the front. And I had done acupuncture before where the needles went right into the area that's painful, and I did not like it nearly as much. So that's sort of the beauty of community acupuncture. Which someone had asked, you know, what does community acupuncture mean? Like, what is the setting like?
So we're in a room with multiple recliners, and you will get your own customized treatment just for you, but you're in a room with other people. So in our clinic, we schedule every 10 minutes. So you'll come in, sit down, we'll talk to you about how things are better, things are worse, what's changed, anything new you want to do. We'll put your needles in, and then you can rest for 45 minutes to an hour. After we're done with you, we'll go on to the next person and do the same thing. So there's private room acupuncture where you have your own private room. And then there's community acupuncture where you're in a room with other people. The reason we can keep our costs so low is because you're basically splitting our time into smaller units. You still get a full hour of treatment, but you only need to pay us basically for the time we're spending talking to you and needling you. So it's a great way to make acupuncture a lot more affordable, so you're not paying for someone's whole room and the whole hour in that room. Private room acupuncture is fantastic as well, and they can do other modalities that often we don't have time to do in a community clinic. So private room acupuncture is wonderful too. But if affordability is your primary concern, and especially for people dealing with chronic pain, you've usually used up a lot of your financial resources dealing with the pain. And when you need acupuncture, you don't just need one or two treatments, you need that long series of treatments. Then community acupuncture can be a great place to start.
Okay, we're just going to do two more questions because we're going to want to jump into our information about Pain Awareness Month. So here's one question. If a person has numerous chronic pain issues, can acupuncture be generalized, or is it usually more of a specific treatment?
Oh, that's a great question. And basically, we go from you and what you want. Definitely, the more issues we do at a time, the less specific our needling can be, and it will be more of a generalized treatment. It's not as strong if we're targeting 10 issues versus 1. But that's okay because it's your choice. If you come in and you're like, I just want you to treat everything head to toe is bugging me, I can't pinpoint one thing, we can treat everything. And if you're like, oh my gosh, I've come to you for all these different things, but today I woke up and I can't turn my neck, can you just work on my neck today? We can work on that. And the beauty is we talk to you each and every time about what's going on, what you want to work on. You're always welcome to change the course of your treatment, change your trajectory. It's entirely up to you.
Awesome. Okay, so last question, but before after the last question, we're gonna switch over to department updates, but I do just wanna remind folks that there's actually a handout that Carrie made for us. And if you look at the control panel on the right side of your screen, you can download that, and that has some more information. I think it has some links on it. Is that true?
There's links to POCA and to NCCOM, just some good information
So
for you.
if we weren't able to get to your question, check out that handout, and hopefully an answer will be there. If not, just shoot us an email at contact@US Pain Foundation, and we can try to help or refer you over to Carrie.
Yep, absolutely.
So our last question is a really great one. Are there things you can do after treatment to get the most out of it?
The best thing to do after treatment is to relax because acupuncture is so relaxing. If you're going to do something like exercise or physical therapy, I recommend doing it first. So you sweat it out, you move it out, and then you come to acupuncture and you relax. That being said, there's nothing against going for a nice walk or doing a little gentle yoga. But if you can refrain from doing anything really physical or really stressful for an hour or two after the treatment, that's ideal. Not necessary. We have a lot of people who come to us on their lunch breaks and they do a quick, even just a half-hour session, and they go back to work and they still see good results. But in an ideal world, if you could take a little bit of time for yourself after and do something relaxing, that would be great.
Awesome. So I had acupuncture before this, so I should go home and relax, is what she's telling me.
Exactly. I think you did your work for the day.
Okay, so thank you so much, Carrie. We really appreciate it.